Hello, everybody. Welcome to another episode of Medical Myths. Today, it is just me. I don't have a guest on because I really wanted to tackle this issue of oxygen therapy on my own. I figured it's going to be a fun time today. So, thank you all for joining me. I see B in the chat. What is up, B? Um, give everybody a little minute to come in. But we're going to talk about oxygen today. And this is something that really gets on my nerves with a lot of things in the public because you see chiropractors prescribing oxygen. You see these commercial businesses now that sell oxygen for just recreational use. If you go to a sporting goods store, you find oxygen canisters being sold just for people to use whenever they want. And you have this trend of oxygen bars, which is another interesting trend where you go into, it's kind of almost like an alcohol bar almost, but you go in and you sit down at the bar, they give you a nasal cannula and you inhale oxygen from this bar. And people are saying that it has all of these health benefits. The main reason I see people using it is for hangover cures. But people seem to think that oxygen is, I mean, it is a good thing, but people assume that because it's a good thing, then that means that more of it is even better. And that's just not the case. Oxygen, like anything else, is a drug. It is something that needs to be regulated and it needs to be controlled by a medical professional. Um, Even if something is benign in small doses, it may not be healthy in large amounts and it might even be toxic. And that is something that we see with oxygen. It is benign for the most part, but there are still risks. So we're going to talk about that today. I have some videos about these oxygen bars, and then I'm also potentially going to be talking about hyperbaric oxygen therapy. And this might be the first of a few videos on hyperbaric oxygen therapy because that one is extremely controversial, especially in the fields of chiropractic. So let's look at the first video, and this is of the oxygen bar. So this is somebody who goes to an oxygen bar. I don't know what country they're in. I think they're in Australia or something. Maybe, I don't know. Oh, I have it on 2x speed. Let's not do that. Here we go.
Oxygen bars have become super popular around the world. We've all seen people post about them on social media, but how many of us know how they work and what the benefits are?
It's so overwhelming.
Basically, what this concentrator machine does is it filters out nitrogen to produce oxygen that's around 95% pure. So to put that in perspective for you, the air we breathe on a regular basis is only 21% oxygen. What's unique about oxygen bars is
so she's talking about this oxygen bar, and it's true that the air we breathe on a regular basis is 21% oxygen. You're not getting 100% oxygen. Most of the air we breathe is nitrogen, and there are reasons for that. We're not going to go too far into that physiology today and about the atmospheric pressure of oxygen. But this is not medical grade oxygen. This is commercial grade oxygen, which is, as she said, is 95% oxygen. Medical grade has to be at least 99% oxygen, usually 100%, and that would be oxygen used for respiratory illness like COPD, for people who have some other kind of, like if you have anemia and you're low on oxygen, you'd be getting a medical grade oxygen. People carrying like the oxygen tanks around with them who have lung disease, that's medical grade oxygen. This is commercial grade oxygen. So you can't be belly up to an oxygen bar in order. No, not really. So they have this little machine that you see behind her that it has different condensers of oxygen in it, and at least it's humidified. That's good because oxygen can dry out your nose and it can cause septal perforations if it's too dry. So they have it bubbling in water, so at least you're getting some humidification with it. But you pull up to this oxygen bar, you put this cannula on your face, and then you plug into this condenser, and you get different like scents. And she's going to talk about this in a little bit, but you have like different like flavors of oxygen that you're breathing in, and you're essentially just breathing in 95% oxygen, which sounds great to somebody who might not know the deal with oxygen and how it is actually a drug. It's a medication that needs to be monitored. This sounds great. 95% oxygen being put into your body, of course, sounds like a fabulous idea. But we're going to talk about why it's more dangerous than we think it is. And we'll finish watching this video before we really get into that side.
Comes with a number of different scented flavors with natural aromas. So you can pick any scent you want and last for around 15 minutes. You can do a 30-minute session if you want. It all depends on kind of your condition.
How do you feel?
How do I feel? I feel relaxed. The wellness benefits of oxygen bar.
So she's going to get into the benefits, and she did give a disclaimer, which is them covering their butt, saying that it depends on your condition, that you shouldn't do an oxygen session for 30 minutes unless it's cleared for you for your condition. And that's an important thing to say because, again, oxygen in high doses is a problem. It is dangerous to have too much oxygen. And in fact, people who have COPD, we don't want them to have a high level of oxygen. So even when we are giving somebody therapeutic oxygen, we aren't always shooting for 100%. So the desired level, if you are at sea level and you were to measure your oxygen saturation, like with the little machine on your finger, typically we'd say 95% and above is good. That's a healthy level of oxygen to have in your blood. But you go to, say, Colorado. I'm from Colorado. I learned to practice EMS in Colorado. So when we measured people's pulse ox in Colorado, we would say that anything above 90 is appropriate, because if you're at 6,000 feet above sea level, you're going to have a lower oxygen saturation. And so you could have somebody on a mountain that has a sat of 90, and that's healthy, and they could still be a healthy person that way. Someone with COPD, so chronic obstructive pulmonary disease, it's a couple conditions where you can breathe in oxygen, but you have a problem expelling carbon dioxide. So specifically, a condition called emphysema. Your lungs get very overinflated. You have too much volume in your lungs. And so they end up retaining a lot of carbon dioxide, and they keep inhaling more oxygen. And this can be a very deadly condition for people. And you might see people with COPD being prescribed supplemental oxygen. But even in those cases, we don't want people to have a saturation above 90. The therapeutic range, at least the target for when we're giving someone with COPD oxygen, we're usually shooting for between 88 and 90%. So we have to be really careful with the amount of oxygen we're giving somebody, and it's really not a good idea to take this into your own hands and just inhale all the oxygen you want. So she says that she is starting to feel relaxed, and sure, having more oxygen can give you feelings of relaxation. But again, you need to be careful with it, and we'll go into that. I'll let her finish up her little thing. So she's going to talk about the wellness benefits of oxygen bars.
It can help with concentration, alertness, reduces stress, improves your sleep. But our favorite, a session of this can get rid of your hangover. I'll see you here Friday morning.
Okay, so she makes some more benign claims. So if someone says that it promotes relaxation or promotes alertness, concentration, these aren't claims that I'm super, super worried about. I'm not worried that someone is going to take that claim and then try to cure someone's disease with it. But even so, we have to be careful because some people, namely chiropractors, a lot of the time, or naturopaths, homeopaths, they do make some more dubious medical claims. So we need to be careful that we're not running with claims that we can't support with data. So this was kind of example, oxygen bar. We'll watch a video about commercial oxygen in a sec. Let me pull that one up. I did not want to do that. I'll just pull it up again separately. But we're gonna look at a product that was on Shark Tank. So this is something that you'd actually see at sporting goods stores. It is called Boost Oxygen. We're going to look at what they are selling us. So this is somebody, he is not a physician. He has no qualifications that would make him knowledgeable on the subject of oxygen and why you would need it. But this person decided to come up with a product that you can buy at a sporting goods store. These cans of oxygen that you put on your face and you breathe. And anyone can buy these. You don't need a prescription. You can just go in and buy this can of oxygen. So let's see what he has to say about it.
CEO of Boost Oxygen here in Milford, Connecticut. Today is April 15th, 2020, tax day.
Actually,
having a great
make
day.
this go faster.
The topic of this week's vlog is, what is Boost Oxygen and why should I use it? Very simple questions for what we do. I figured I would answer as succinctly as I can. And so what is Boost Oxygen? Boost Oxygen is 95% pure oxygen gas compressed into an aluminum canister and actuated by a patented mask. It is limited quantity aviators breathing oxygen. It is not medical oxygen. It's not classified as such. It's aviators breathing oxygen, same oxygen that pilots get or that you would get in an airplane. The difference.
So there he goes, starting off once again, saying that it is commercial grade oxygen. It is not medical grade oxygen, so it is 95%. And then he has an interesting argument here that he's trying to be persuasive in saying that it is used by pilots on an airplane. That's used to try to give him some credibility in saying this. Like, oh, pilots use this when they're at high altitudes, so people should buy this. It's good for you. And that's not really a good argument to make. Not everyone is on an airplane. And I will say, something like this can have its benefits. I'm not going to say that there's no reason to have this kind of supplemental oxygen. Supplemental oxygen can be great for people who are in an airplane. If you're at a high altitude and you find yourself needing a little bit more oxygen, that's probably fine. If you're at high altitude, you're climbing a mountain and you've exerted yourself a lot and you're feeling a little lightheaded, sure, have some oxygen at high altitude. But there are very limited scenarios where this would actually be beneficial. Most of the time, just having a canister of oxygen is unnecessary. You're spending your money on something that's not going to be needed. Most people have the ability to intake the oxygen that they need from the air. We don't need anymore. And then people who do need more oxygen, if you have a medical condition that would require supplemental oxygen, you should not be buying it from a sporting goods store. You should be getting it from your doctor. Your doctor will prescribe you a medical grade oxygen, and they will prescribe a certain flow rate that you should be using to get your oxygen. So this really isn't necessary. If you want to climb a mountain, okay, fine, take this with you. But most of the time, healthy people do not need supplemental oxygen. It is a waste of money and just a waste of time. But this man wants your money, so he's going to try to convince us. Let's see if he can do it.
Between aviators breathing oxygen is that it's not regulated by the FDA. It also doesn't contain any humidity. A lot of times medical oxygen will contain humidity. It's also 95% pure oxygen, whereas medical grade oxygen is 99.2% or above. But oxygen in general, and Boost Oxygen, is an all-natural product that is intended for all natural.
There's that buzzword, all natural. It is an all-natural product.
Support. And people take this for granted, and even though that oxygen is tasteless, odorless, and non-toxic, it is actually a very potent gas. The air we breathe is 21% oxygen is very potent. Most of it is 70% nitrogen gas, which is inert and essentially useless. And Boost Oxygen is essentially concentrated oxygen. Well, we take all the nitrogen out of the air we breathe, and we're left with 95% pure oxygen. And how potent is oxygen gas? I get that all the time. Well, if you stop breathing or you hold your breath for a minute, you'll find out.
Okay, and this is a fun little thing here. So people love to use the word pure. But when we're talking about a pure substance, that means that it is only that substance. So if it is 95%, it cannot be pure oxygen. It cannot be, because that other 5% is not oxygen. It is something else. So the only way it could be pure is 100% oxygen. This is not a true statement, but he's using it as a buzzword. I'll answer your question here. Would something like this help you catch your breath faster after doing something strenuous, like a long sprint run? Potentially, yeah. Potentially, it could be helpful for something like that. Although, definitely, like, if you want to have a pulse oximeter with you and your oxygen levels are sufficient, if you're over 95%, on that monitor, you probably don't really need it. It might make you feel better, and in small quantities, it probably wouldn't hurt you. But yeah, if you monitor yourself for under 95 and it gives you a little bit of relief, I don't have a huge problem with that.
That how potent oxygen gas is essential for life and very important to continue to be on this planet. So why do people use boost oxygen? Concentrated and supplemental oxygen, what boost oxygen is, delivers more oxygen through the lungs to the body. Every cell in the body needs oxygen. When people don't get enough oxygen, or the cells aren't getting enough oxygen, for whatever reason, they feel it, and usually pretty immediately. It can be from the high altitude. It can be from poor air quality. It could be overexertion, alcohol, being congested, not used to working out, swimming in chlorinated pools, just physical activity, just being older. There are many causes of oxygen deficiency. And as each cell...
Oxygen deficiency. That is not a term that we use to describe having a low level of oxygen. So he's kind of outing himself here as not a medical professional, because when you have low oxygen in your body, it is called hypoxia, or that specifically refers to low oxygen in your tissues. If we're talking about low oxygen in your blood, that's hypoxemia, and you can be symptomatic with hypoxemia for sure. And hypoxia, you can get headaches, you can get exercise intolerance, you can get a number of symptoms from being hypoxic. But oxygen deficiency is not how he would describe that. He's demonstrating that he doesn't really understand the topic, and most people are not oxygen deficient. Most people have a good amount of oxygen in your body. So it sounds like he's trying to make it seem like more people are oxygen deficient than actually are. He's trying to snare in the majority of the community to buy his product. Obviously, he's a businessman. He's trying to sell this. But most people don't need it.
And the body can be affected. Brain cells and muscle cells are really the big two. People use boost oxygen to feel better, to breathe better, to recover faster aerobically, to become more alert, to energize themselves, to perform better, to return to their athletic best more quickly, to get more oxygen into their body to the cells that need it. It's very simple to use.
And he's going to take a hit on air.
It's a very straightforward concept. Supplemental oxygen in a canister has become very popular in the high altitude regions in the United States, where it's sort of common sense. People go to visit high altitude areas over 5,000 feet, and they feel
this is a case where it makes sense.
The reason they feel crappy is because
on a mountain,
they have less oxygen in their bodies, and they know that breathing in supplemental oxygen is going to help them feel better. So we've done very well in high altitude areas. We've done very well with people who just have breathing issues, where they're looking to add additional oxygen into their bodies to support them.
Okay. So if you have a medical issue where you don't have enough oxygen, you should not be taking this into your own hands. You should be talking to a medical professional, because even something such as low energy, if you have chronically low energy or chronic headaches, chronic fatigue, that's not something that you just want to do some supplemental oxygen and figure out on your own. There are a number of reasons why you could have those conditions. Namely, thyroid is a big one. You could be anemic. You could have a pituitary issue. You could have a lung disease. You could, like, any number of these differentials could be present, and you should not take this into your own hands without talking to a medical professional who can adequately diagnose you with one of these. Also, things like diabetes, Cushing's disease, those kinds of conditions can cause you to have low energy or poor concentration. And that's not something that you can control on your own. That's not something you should try to control on your own. Please, if you have some medical conditions or medical symptoms that are causing distress in your life, go get evaluated for it. But don't go see a chiropractor. Don't just go buy a supplemental oxygen canister. It's probably not going to do much for you. Except for, it'll lighten your wallet a little bit.
Their daily activities. We're also athletes have adopted oxygen, supplemental oxygen as a way to recover faster and get back into the game at a higher level than they would aerobically. So we're very proud of what we've done. We've been in business for 12 years. We're helping a lot of people for a lot of different reasons. And during this crisis, actually having a little extra oxygen on hand has really helped people as well. So we're very proud of what we've done here.
Oh no. When was it? Yeah, this was made in 2020. He just said that in this crisis, the supplemental oxygen has been helping a lot of people. And okay. If you are mildly symptomatic with a certain viral infection that's going around, and you don't want to infect other people, you're not severe enough to where you need to go see a doctor, okay, you could have one of these on hand, but use it sparingly. But if it comes to a situation where you are really feeling crappy from having a viral illness that affects your lungs, you need to be evaluated. People are being hospitalized for COVID very quickly. And even what we're seeing in the hospitals is that the hypoxemia associated with COVID comes on very, very quickly. There's usually a stepwise process in how we would escalate the situation. Normally, if you come in with hypoxemia, we would give you a nasal cannula, like the thing that goes in your nose. That's step one. If you are mildly hypoxic, we'll give you a nasal cannula, and hopefully your stats will go up. If that doesn't work, then we'll give you just a mask, not a non-rebreather mask, just a regular mask. And that will, because when you have the nasal cannula, a lot of the oxygen you're breathing some in, but a lot of it goes and dissipates into the air around you. It doesn't all go into your nose. So if you're having trouble getting the oxygen from the cannula, you switch to a mask, and that'll trap the oxygen in the area and help it get into your lungs easier. And then if that doesn't work, we give you a non-rebreather mask. And the non-rebreather essentially allows you to get in the oxygen and keeps that in, but also helps you expel the carbon dioxide. So you're not intaking more carbon dioxide than you need, because obviously you might have too much carbon dioxide if you're breathing in straight air from a mask that's keeping it close to your face. So after a non-rebreather mask, we would put you either on a BVM, or we maybe put you on a BiPAP or a CPAP, or if it gets really bad to where you cannot ventilate yourself anymore, then we will probably intubate you and put you on a ventilator. So with COVID, what we're seeing is that instead of going on this stepwise process from the cannula to the mask to the non-rebreather to the CPAP and then to the tube, we're going pretty much straight from the cannula to the tube. It's a very rapid deterioration that we see with COVID. So if you have significant symptoms of hypoxia and you have COVID, this is not going to help you. This boost is not going to be enough. You are going to deteriorate very quickly, and you need help ASAP. Do not take your chances with that. So he should not be using that to market the products. Nobody should be using COVID to market their recreational oxygen. That is just not appropriate and can be very detrimental to people. So trying to decide if I want to cover, you know what, let's go into oxygen toxicity first before we go into hyperbaric oxygen. Because I've talked a lot already about these products, but why is oxygen more problematic than people are saying? Why is this such an issue? So I have some studies here. And you know what, let's do some practice questions before we dive right into the research. Okay, so these are questions for medical boards, so they don't need to make sense necessarily. We're just going to use them as examples of where we get problems with oxygen. So we have somebody here who is a 32-year-old male deep sea diver who is admitted to the floor, the inpatient floor, for monitoring possible oxygen toxicity. How long does it take for pulmonary oxygen toxicity to develop? So the answer choices are 2 hours, 6 hours, 8 hours, or 12 hours. What do you all think in the chat? And I won't make you all... This is not a graded quiz, but just to give you all a little taste of what we're dealing with. The answer is 12 hours. It takes about 12 hours to develop pulmonary oxygen toxicity if you are at sea level. So if you were to have oxygen for long periods of time, especially 12 hours, and we're talking, this is now medical grade, talking medical grade oxygen, 12 hours is probably going to give you some toxicity. And we're going to talk about these teacher points here we'll go into with the article. But there is one more question that we're going to do, and this is a clinical scenario. So we have an 80-year-old man with a past history of diabetes and hypertension presenting to the emergency ward with difficulty breathing. He had a myocardial infarction 3 years back, so he had a heart attack 3 years ago. Since then, he has had multiple hospitalizations for difficulty breathing. So this is a repeat thing. He chronically has difficulty breathing and has been hospitalized for that before. At present, he complains of dyspnea, so difficulty breathing, orthopnea, which is difficulty breathing while laying down, and fatigue. He's lost 16 pounds of weight in the past 2 years. On examination, the temperature is 36 degrees Celsius. That's not concerning. Respiratory rate is 90 per minute. So the average person should be breathing between 12 and 20 times per minute. 90 times per minute is a lot. So if you think about a metronome going at 90 beats per minute and then think about breathing that quickly, that is extreme hyperventilation, and that is problematic. So if someone is hyperventilating that quickly, we're concerned. We're very concerned that they have some kind of pathology going on, and we need to worry about that right away. Their pulse is 90. That's normal. Their blood pressure is 80 over 50 millimeters of mercury. That is incredibly low. That is dangerously low. He has weak pulses because he has low blood pressure, and his oxygen saturation is 80%. Cardiovascular examination reveals elevated jugular venous pressure. So his neck veins are distended. He has a downward displaced apex beat, S3 present with no murmurs. I'm not going to go into why that's important. Respiratory exam revealed bilateral basal rales and crackles. So if you listen to his lungs, they'd sound very, very bad. Sound kind of like a very crackly sound, as it says. Bilateral pedal edema. So he has swelling of his feet. If you were to put your hand around his calf and push your thumb really hard into the skin on the front, it would pit. And it would just stay like that. Like, if you have some a block of foam and you push on it, it leaves a dent in the foam, and then you let go, it usually fills back in. It doesn't stay as a pit. But if you take a banana or something, if you take a fruit and you stick your thumb in it, it might leave a little dent afterwards. That's what we're talking about. It's very swollen to the point where you can leave a dent just by pushing on it, and that's pedal edema. His chest X-ray revealed a large heart and evidence of fluid in his lungs. So pulmonary edema is fluid pushed into his lungs. The echo, so an ultrasound of his heart, showed large cardiac chambers with a decreased ejection fraction. So he's in heart failure. He's on a bunch of meds. For those of you that may care about that, lisinopril, carvedilol, spironolactone, and metformin. And then he was added, furosemide was added, and that's a water pill to cause him to try to expel a lot of the water that he has. He's being evaluated for a pacemaker. Supplemental oxygen therapy is started for the dyspnea. He has advised for long-term home supplemental oxygen therapy because of decompensated heart function. What is the major concern about treatment with high-flow oxygen for long periods? Okay, so we have somebody who obviously, that was a lot of essay that we probably didn't need to know. But this person needs oxygen, right? He's in a very severe pulmonary respiratory decline. This is dangerous. This is somebody who does need oxygen. But there is concern here. And this is an interesting question to look at because pneumothorax, pulmonary hypertension, and atelectasis are all consequences as well of pulmonary toxicity. So breathing this high flow oxygen for a long time can lead to pulmonary toxicity, and we're going to talk about that. So let's look at a paper here. This is from Stat Pearls. So this is kind of a platform that helps a lot with medical education. So we're talking about how oxygen can be toxic. So they're saying that oxygen is vital to sustain life. However, breathing oxygen at higher than normal partial pressure leads to hyperoxia and can cause oxygen toxicity or oxygen poisoning. The clinical settings in which oxygen toxicity occurs is predominantly divided into two groups. One in which the patient is exposed to very high concentrations of oxygen for a short duration, and the second where the patient is exposed to lower concentrations of oxygen before a longer duration. So the two scenarios, either you are taking in a very high amount of oxygen all at once and causing the toxicity, or you could have a low concentration of oxygen over a long period of time causing the toxicity. And so you can get acute toxicity, you can get chronic toxicity, so over a short period of time or a long period of time. And acute toxicity generally manifests with central nervous system effects, so it's going to affect the nervous system. And then chronic toxicity has mainly pulmonary effects. And severe cases of oxygen toxicity can lead to cell damage and death. Those at particular risk for oxygen toxicity include hyperbaric oxygen therapy patients. Whoa, that highlighted way too much. Hyperbaric oxygen therapy, patients exposed to prolonged high levels of oxygen, premature infants, and underwater divers. So oxygen, I'm going to talk about this briefly. So oxygen is a great thing. Of course, we need it to survive. But oxygen undergoes reactions that produce free radicals. So if you've heard about antioxidants before in the media, you may have heard of acai is an antioxidant, or XYZ herbal remedy is an antioxidant. What does this mean? An antioxidant is there to pick up free radicals. Free radicals are electrons that are just floating around. If you have an electron by itself that's not attached to an atom or attached to a molecule, it is called a free radical, and that can cause damage because it'll start reacting with a lot of things around it. It'll start bonding with things, and it can be problematic. So people advertise antioxidants as a way to get rid of these free radicals that can cause inflammation, and that can cause tissue degeneration, tissue necrosis. But your body has certain antioxidants as well. You produce glutathione that can help with this. So free radicals can be dangerous. They are also necessary for certain things in the body. In fact, the electron transport chain in your cells, when you undergo metabolism to produce ATP, you have to produce free radicals in moving the electrons from each of the cytochromes in the electron transport chain. You need free radicals for that. But these oxygen can produce these free radicals. It can cause tissue damage. It can cause inflammation, especially in high amounts. And this is where we get the problems. So CNS effects secondary to oxygen toxicity is known as the BERT effect. And they're saying here that the statistics with hyperbaric oxygen therapy, they're saying the overall risk may be as frequent as 1 in 2,000 to 3,000 treatments. And that sounds like a lot, right? So, okay, sure. I'm probably not going to be the one, like, if I'm getting hyperbaric oxygen therapy, I'm probably not going to be getting 2,000 or 3,000 treatments. But if you're a chiropractor giving hyperbaric oxygen therapy to a few thousand people, this is a very low number of people that can be getting toxicity from it. And they're saying that this risk might be as high as 1 in 200 at higher pressures. So 2.8 to 3 times normal atmospheric pressure, or 1 ATA, and as low as 1 in 10,000 for treatments at 2 ATA or less. So 1 in 10,000 seems to be not very likely. But if you take into account all of the people prescribing hyperbaric oxygen, you could very easily be one of those people that is at risk. And the incidence of displaying CNS symptoms is 2% with a seizure rate of 0.6%. So 0.6% of these people who get nervous symptoms from hyperbaric oxygen therapy, or just oxygen toxicity in general from oxygen therapy, is about 0.6%. That was a lot to cover. Do we have any questions in the chat so far about what I've said? So I talked a little bit about free radicals, kind of. I might do a whole separate video on free radicals and antioxidants. The histopathology, let's talk a little bit about that. So oxygen toxicity stimulates development of histologic changes in the lungs. So you can get pulmonary edema, you can get congestion, you can get hemorrhage, and they're saying when they look at this tissue under microscope in a path lab, you can see that you've had expression of inflammatory mediators such as cytokines, and you're getting inhibition of normal endothelial function, and this can be a problem. So 100% oxygen can be tolerated at sea level for about 24 to 48 hours without any severe tissue damage. But you can get some moderate irritation of the carina in your bronchi after 3 to 6 hours of exposure to 2 atmospheres, and extreme irritation with uncontrolled coughing after 10 hours, and finally chest pain and dyspnea. So difficulty breathing and chest pain will happen probably after about 10 hours of 100% oxygen therapy. So while the commercial grade oxygen was 95%, I'm sure that these time frames are going to be extended since it's 95% oxygen and not 100% oxygen. But still, you're getting some irritation after 3 to 6 hours. And so this is an example of why you need to be very careful. Don't go to an oxygen bar for 3 or 6 hours. Don't just hang out there. Don't just chronically use these oxygen canisters. That can cause toxicity. So less is probably better. More of oxygen is not necessarily better. So what happens with oxygen toxicity? So symptoms may include disorientation, breathing problems, and visual changes such as myopia and cataracts. Yes, you can get cataracts from having too much oxygen in your body. The nervous system effects might be headache, irritability, and anxiety. And that's usually when you're hypoxic or even hyperoxic, having a lot of those free radicals and that tissue damage in your nerves and in your brain can cause, of course, some irritability and anxiety. Probably anxiety a lot to do with senses of impending doom, feeling like you're going to die, that kind of thing. Dizziness, disorientation, hyperventilation, hiccups. Yeah, I mean, sure, hyperventilation and hiccups are pretty much guaranteed, as that would make sense. Cold shivering, fatigue, tingling in the limbs, visual changes such as blurring and tunnel vision, tinnitus and hearing disturbances, nausea, twitching, and tonic-clonic seizures. So you can get seizures from having too much oxygen. And as we said before, central nervous system toxicity is usually if you had an acute exposure, this is more what you're going to get. If it's over a long period of time, like if you're having, this happens to preemie babies. Yeah, if you're in the NICU and you're on an high O2 incubator, you can get neonatal cataracts from that. That is exactly how this happens. So if you're on oxygen chronically for a long period of time, you can get pulmonary toxicities. So you get a mild tickle sensation on inhalation, sure. Mild burning on inhalation, yeah, I mean, that makes sense. Uncontrollable coughing due to inflammatory changes. Hemoptysis, which is bleeding. So if you cough up some like phlegm that has blood in it, that's hemoptysis, or any kind of coughing up blood would be considered hemoptysis. That is a risk with hyperoxia because you're causing inflammation in the lung tissue. You're causing capillary rupture in the lungs that can lead to hemoptysis. Dyspnea, of course, difficulty breathing. Rales, which is crackles in the lungs. You can get a fever due to inflammatory responses. Hyperemia of nasal mucosa, I mean, that's not really super detrimental. That's just higher blood flow in the nasal passages. Signs of inflammation and pulmonary edema. So you can get some fluid and swelling in your lung tissue. And then eyes, here we go. Titan in premature babies, retinopathy of prematurity and retrolental fibroplasia, retinal edema and cataract formation for long-term exposure. Yeah, so oxygen isn't benign. It is not something that you should just monitor on your own. If you want to be on supplemental oxygen, talk to your doctor. It is risky. And again, I'm not saying that a little bit of oxygen would necessarily do any of this. We're talking high levels of oxygen over a short period of time or chronically low doses of oxygen. But either way, just because something is beneficial and just because something is necessary for your body to survive does not mean that you can have a lot of it and that it would still be okay. Oxygen is a drug, and I will keep saying that. Oxygen is a drug. Treat it as such. Regulate it as such. So if somebody comes in with oxygen toxicity, basically they're going to be presenting like acute respiratory distress syndrome, which is actually what we see in the reason why we hospitalize people with COVID is acute respiratory distress syndrome. This is essentially what you're doing here. With the free radicalization of oxygen, you are causing you're causing the exact same pathophysiology as in COVID with this high level of oxygen. And I think there's a part in here that covers. I actually think it's higher up. I'm going to go back and. Did I? There's a part. I don't think it's in this one. I might actually be in a different paper that talks about this. I have a couple papers to bring up. But yeah, so you can get acute respiratory distress syndrome from free radicalization of oxygen. So how do we treat this? How do we monitor and manage acute oxygen toxicity? So of course, you're going to reduce oxygen levels. You're going to take them off of whatever supplemental oxygen they're on. That's going to be the easiest way to do it. If you had a hyperbaric oxygen treatment, you might need to start a treatment of anti-epileptic therapy, is what they're saying. You might have to give them something like valproic acid or another medication that would prevent them from having seizures. So taking breaks if you're in a hyperbaric oxygen chamber, obviously not being in there as long can help you. So deep divers. Diving is a case where we see a lot of oxygen toxicity. Of course, if you're underwater and breathing in a lot of highly concentrated oxygen, you might need to reduce the level of oxygen in their oxygen mixture that they're using underwater so that they're not getting these effects. So that's something that you can do. But here's something that's interesting about oxygen toxicity, because it's not common. As I showed, maybe 1 in 10,000 people who receive oxygen therapy would suffer from oxygen toxicity. But it's probably going to be misdiagnosed when it comes in, because, as I said, it presents as ARDS. This can be caused by a number of things. So differentials, how we determine it is an oxygen toxicity versus any one of these, and that is a question. So you need to rule out carbon dioxide toxicity. That presents very similarly. Carbon monoxide poisoning presents very similarly. And something interesting here is the treatment for carbon monoxide poisoning is the exact opposite of the treatment for oxygen toxicity. So if you had somebody coming in with this, I'm probably more likely to think that they have a carbon monoxide poisoning because that's more common. But a treatment for carbon monoxide poisoning is hyperbaric oxygen therapy. So if I put somebody who I think has carbon monoxide poisoning in a hyperbaric oxygen chamber and they actually have oxygen toxicity, I am making their issue worse. So this is why you need to be very careful with stuff like this. You need to make sure that the people treating your conditions are medically trained, that they're not a chiropractor, they're not a homeopath, they're not a naturopath, because they might miss this. They might throw you in an oxygen chamber, which is the exact opposite of what you need to do. Because also, to diagnose the oxygen toxicity, you're going to need arterial oxygen levels, which would probably be done in a hospital setting. You're not going to get that done in an office. So that misdiagnosis could kill you. It could be differential, could be toxin ingestion, a stroke, migraines, seizure disorders, infections, MS, hypoglycemia. All of these would need to be ruled out. So, I mean, the big one here was the carbon monoxide poisoning. That's a huge one. Yeah, and Godless Granny, that's a good point. Nitrogen issues are definitely common in divers, and scuba diving is a case where, yeah, you probably need more supplemental oxygen, and that is a case where hyperbaric oxygen is beneficial. And we'll get into that. I think that's kind of. I mean, we'll go over these clinical pearls, and then we'll jump into hyperbaric oxygen. So their clinical pearls here, and kind of the education they're trying to get at here, is that there's wide variability in susceptibility to oxygen toxicity. Increased seizure risk is linked to retention of carbon dioxide, underwater immersion, exposure to cold, and exercise. Scuba divers use breathing gases contain up to 100% oxygen and should have specific training and safe use. In recent years, oxygen has become available for recreational use in oxygen bars. The FDA warns those suffering from problems such as heart or lung disease to not use oxygen bars. So oxygen bars and recreational oxygen are not good for everybody. Please use appropriate discretion when wanting to do something like that. Don't just buy into something that someone says about oxygen bars making them feel better, because it might not be appropriate for you, and it might cause seizures for you. It might cause cataracts for you. It might cause these other issues that we discussed. So let's shift gears a little bit here, and we're going to talk about hyperbaric oxygen, because this one really grinds my gears. One sec. Okay. We're going to talk about hyperbaric oxygen, and this is one that I have some experience with, because there was a while back, and I think this is still going on. People are using hyperbaric oxygen to treat autism and ADHD and a number of other issues, and it is dangerous, and it is not FDA approved for use in autism or ADHD. But there are clinics, especially in Florida, that will put autistic people in a hyperbaric oxygen chamber and think that it's okay. It is not okay. It is not okay to do that. There's no evidence behind that. But people are buying into it. Especially the anti-vax crowd is buying into it. And I have a video here from a chiropractor who uses hyperbaric oxygen, and you can tell he has no clue what he's talking about. He makes it very clear that he's taken enough biology to be dangerous. And I will explain why. And before we go into this, again, I'm not saying that there aren't any appropriate uses for hyperbaric oxygen. It is an appropriate therapy for some very specific issues. It can be used to treat the bends or decompression sickness, like Godless Granny was just talking about. That is appropriate. It's appropriate for people with anemia, potentially. The FDA also approves it for gangrene, which makes sense because that's a hypoxic injury. It can be used for burns. It can be used for carbon monoxide poisoning, crush injuries. It can be used for radiation injuries, and it can be used for wound healing. So if you have a diabetic foot ulcer, that is it's a hypoxic injury. You're not getting oxygen to that part of the foot, and that can cause problems. So the FDA has approved hyperbaric oxygen for diabetic foot ulcers and for wound healing. Those are okay. And I'm not talking about its use in those cases, but people have taken this and said, oxygen's great. Let's give it to everybody. We can peddle it as this vague cure-all for whatever. And since people give anecdotes of, I felt more relaxed, or it improved my concentration, that's just more ammo for people who don't understand what they're talking about. So let's watch this chiropractor and see what he has to say about it. And actually, let's watch it at 1.5 speed, because I don't want to listen to talk any longer than I have to.
Hyperbaric oxygen therapy. What's happening here is that we have a person's lungs. And we still have to breathe in the oxygen.
His physiology explanation isn't incorrect. He's right about how it works
into the lungs,
where it usually physiologically
does. And alongside the lungs and surrounding all of these are your blood vessels. They're in the periphery, and they have all kinds of little red blood cells in them.
I might just skip ahead, because I can.
And these are for our bones.
I can talk you through the mechanism here.
This oxygen.
So hyperbaric oxygen, essentially, it's an increased pressure of oxygen, and it forces oxygen into the blood vessels, because oxygen travels via diffusion. If you have a higher concentration or higher pressure on one side, it's going to push the oxygen over to the other side, and it's going to make it more soluble with the high pressure. So basically, he talks about how you're going to get higher concentration of oxygen in the blood because it's now soluble. It's not bound. It doesn't have to be bound necessarily to the red blood cells. It can just float along next to it in the plasma. So he doesn't get that wrong. But I'm going to skip ahead to where he starts making some claims about it.
Concentration actually diffuses way further into our tissue. And at 2 atmospheres of pressure, we actually dissolve the oxygen about 400% deeper than it normally would. So that means you're getting...
So I want to address one thing here really quickly, comparing this back to the article that we just looked at. So he's specifically mentioning here 2 ATAs, so 2 atmospheres of pressure in this hyperbaric oxygen therapy. Remember, the last study we just looked at talked about 2 atmospheres greatly increasing your risk of oxygen toxicity. So just keep that in the back of your mind as we go through this.
A lot more oxygen into these areas of the brain in the heart and the joints, or the bones and the joints, and all these tissues that need oxygen to heal. And not only that, but the pressure actually creates an increased pressure within the bloodstream as well. So that pressure, just in general, call it P here, actually pushes the blood flow further into tissue. And so it's farther into tissue. So we can really actually just utilize all of our vasculature as well, in addition to this scenario here, where we're getting blood flow way deeper into the surrounding tissues, which is really exciting. Now, when we talk about oxygen and why it's important, we have to talk about why it's important, because we know it heals and we know it's important, but oxygen is really important because oxygen is what is required to make energy. Okay, and energy in the body is in the form of ATP. That's called adenosine.
Yes, you use oxygen as the final electron acceptor in the electron transport
TCA cycle. But basically, there's this thing called the electron transport chain, and that is a chain that has to go through a few processes to make energy at the end. And so what it needs is this oxygen as its final electron acceptor. It's known as.
He's not wrong there.
So in other words, all things considered, you can have all the components of the pie. You can have everything you need. You can make the perfect pie, but if you don't have an oven, it's not going to bake the pie. So in this case,
that was a terrible analogy. I don't know why he needed to make an oven.
If we don't have oxygen, that's our oven. We can't bake the pie. So oxygen is required to make energy. That's why if we don't,
okay, no, it is okay. He is partially right. For long periods of time, you will need to undergo aerobic respiration, aerobic metabolism, but that is not the only way to produce energy. You do not need oxygen to produce ATP. You can do it through glycolysis. This is why we store glycogen, is for glycolysis and anaerobic metabolism. So no, you don't need it. Well, okay. You need it over a long period of time. You're not going to be able to last very long on only anaerobic metabolism. So at some point, you are going to need to undergo the Krebs cycle and use the O2. But he's not right in that you 100% all the time need to have oxygen to produce energy.
Because we lose oxygen, of course, to our precious tissues and in all cells, right? Every cell in the human body, neurons, cardiac cells, chondroblasts, osteoblasts, all these cells, immune cells, they all need oxygen to make energy. And when they have that, then they can make more components.
No, actually, that's false. That's false. Not all cells in your body undergo aerobic metabolism. Certain cells in your body favor glycolysis. I believe there are cells in the kidney that favor glycolysis over aerobic metabolism. Blood cells favor glycolysis. So that's not true. Not all of your cells need oxygen necessarily as their primary source of energy. So he's wrong there. But that's just me being a little pedantic.
That are needed to make the cell healthy. So we get regeneration and revitalization of our cells. You say, well, that's great, but what about my organs? Well, cells
make up revitalization. Revitalization. What do you mean by that? What do you mean? How does it revitalize? Can you give me a mechanism such as it stimulates production of proteins, stimulates repair of cell membranes, stimulates DNA repair. There are mechanisms that would contribute to revitalization of a cell. He's not going into that. So he's using a buzzword with revitalization to make a claim that you're going to need this hyperbaric oxygen therapy. So he's given us basically a 9th grade level education of cell bio, but can't describe the mechanism by which this happens.
Organs are just a collection of cells that make tissues that end up being organs. So that's just a little biology for you, but that's microbiology. So that's really
microbiology.
One of the main ways that
he says that as though like the knowledge that he's already given is this advanced level of cell bio. This is 9th grade biology. Like this isn't no.
Therapy
sorry, dude.
Works. And when we look at this picture, it's pretty exciting because we say, well, geez, if I can just do that enough, I should be able to heal most of my cells. And that is true. That is what we see. We see that.
No. This is where it gets dangerous. He said, so if you should be able to do that enough, you should be able to heal every cell in your body. So he just made the claim that more oxygen is better. And as we saw in the paper we just read, that is not the case. More oxygen does not equal better. So he's making a claim there, and he's kind of sneaky about it.
That these cells become very healthy, and the brain, especially, we really love at the lower 1.3, 1.5 chamber pressures, because that's the best neurocognitive effect, which is the chambers that we use primarily in my office, but because of that effect on the brain. And so when the brain can work better, it does all kinds of different things, and everything really, of course. And it can, now it has all these tissues that it can now utilize better because they're healthier. And so signaling improves. So all the signaling that comes from these organs to the brain, and then the brain is functioning better, so it can process it better, and it can loop back down to control those organs or tissues, whichever, so that it's a really nice cycle of function that is turned back on so that we can be healthier individuals. Now,
I need a citation about how oxygen improves signaling, but that's besides the point.
What happens as well simultaneously, which is really exciting. Let's just erase just a little bit of this here so we can draw a few things. Let's get that there. Okay. That the increase in oxygen is not the only thing that's actually helping these systems heal. And this is really exciting because...
Oh, and I should probably mention here, we'll take a little pause for a sec. So I looked at his description to see if he had any sources posted at all for any of these. Nope. His description just says oxygen healing, and that is it. There are no citations for any of this that he says. And he is supposedly from Portland Chiropractic Neurology, that sounds very sketchy. Chiropractors are not neurologists. I'm going to do a separate episode of Medical Myths about chiropractic neurology because it is horrifying, the things that they get away with. But this person is presenting himself as a neurologist, and he cannot provide sources for the claims he's making and just says oxygen healing, which is, again, a buzzword. It's very vague. What kind of healing do you mean? I don't know. But that's incredibly, incredibly sketcy.
The additional healing comes from with hyperbaric, and it's very, very important for a lot of the conditions that we treat. And so one of the things that it does, in addition to the oxygen under pressure, right, we'll keep that there, is that it also is a really important modulator of inflammation.
So here we go. And he's going to talk about inflammation.
And we like to use the word downregulation when we talk about chronic inflammation. But initially, when you have inflammation or damage, let's say, to tissue, you get leakage of blood vessels. So you're getting leakage of these internal components, within the bloodstream. And what that creates your inflammation. And that's really important because that creates a lot of pain, creates dysfunction, creates swelling, damages tissue.
Nope. That's backwards. So capillary permeability does not cause inflammation. Inflammation causes capillary permeability. So cytokines and interferons stimulate increased capillary permeability, which does cause your white blood cells and other inflammatory mediators to permeate into the extracellular matrix. And that is where you get tissue inflammation. But you don't, this increase in permeability is not what causes the inflammation. It is the inflammation that causes the permeability. And these people love to use inflammation as a buzzword, that disease results from inflammation. And there's a lot more nuance to that. Inflammation is an important part of the body. It has a lot of important functions. Of course, if you do not have inflammation, you can't get rid of diseases. It is your innate immune system. So I'll let him talk a little bit more because I know there's stuff here that really, really makes my blood boil.
Increases all your inflammatory cytokines and all these different things that are important to regulate, especially, let's say, after a concussion or a head injury that you have you hit your head, and now we're hitting our head here, and now we create swelling in the brain, and now this brain is being compressed and injured, and certainly not getting very good blood flow to itself, and it can create some long-term damage there. So we don't love that, and so we would love to have a mechanism that can reduce that. And hyperbaric does just that for us. So what hyperbaric does is hyperbaric oxygen creates vasoconstriction. So it actually, if we're going to use the same blood vessel, we'll take that blood vessel and make it smaller. And so what that does is that prevents or really reduces the leakage of the blood vessels. And now what happens is when you create vasoconstriction, you also reduce oxygen or blood flow. That's really what we're doing. So we say, well, geez, that's not good to reduce oxygen necessarily to our tissues that are injured and actually starving and need that to create energy and heal. Well, that's correct in that. So with hyperbaric, we actually don't lose any of that oxygen because we still have a net positive of oxygen, because these oxygen molecules, which are much tinier, that are in the plasma, can still get into all the tissues, remember, much deeper because of the oxygen concentration.
All right. So in a case where we have some ischemic injury, yeah, we do want some oxygen, absolutely. Inhibiting inflammation isn't the way to improve oxygen, and we need inflammation. Like I said, you need inflammation to treat a lot of these conditions. If you have cellulitis or you have some kind of infection in your tissue, you need to get you need an inflammatory response. That's going to help you out. If you have COVID, you're going to need an inflammatory response. That's not a problem in a lot of cases. And I do understand something with a brain injury. If you get a brain contusion and you get swelling, you don't want swelling in your brain. That's going to cause pressure issues and cause further brain damage. But there's a lot here that's not really, I mean, I can't really say anything against the fact that having soluble oxygen can be beneficial in these cases. But preventing leakage is not really the goal here necessarily. And if you have a case where you have a concussion, if you have cerebral edema, if you have some other head injury, a stroke, why would you go to a hyperbaric oxygen chamber first? Why would that be your first line? It should never be your first line. You should go to a hospital where you can be treated by a real neurologist. So yeah, theoretically, could you cause some benefit with hyperbaric oxygen? Maybe. Is it worth taking the extra time? If someone has an ischemic injury, which is time sensitive, the time for if somebody has a stroke, you have about 4.5 hours to use TPA or some kind of anticoagulant. You have maybe about 6 hours to 12 hours. I think maybe 12 hours is the limit now for mechanical thrombectomy to go in and actually remove the blood clot. It's very time sensitive. Cerebral edema, if you have a cerebral contusion, it's very time sensitive. Your brain can swell very quickly. You need to act right away. So even if hyperbaric oxygen could be beneficial in that case, why would you do that first? That is dangerous to imply that this chiropractor's hyperbaric oxygen therapy in his neurology office could help with that. You need intervention now. And this is where lives are being taken by people like this.
Concentration gradient that will allow that tissue to heal, which is really wonderful. And it also reduces chronic inflammation, what we see with like neuroinflammation is a good example. And it downregulates a lot of these genetic marker or genetic components that will create cellular death, inflammation, all of these pieces that we really don't want expressed in our cells and genes.
He just said something weird. He just said that the hyperbaric oxygen can downregulate genetic markers. What? No, it cannot do that. You cannot downregulate DNA with oxygen therapy. That's just downright ridiculous. He's using scientific terminology that he barely understands and trying to sound like he understands it. But when you break this apart, he has no idea what he's saying. Also, in all fairness, I have no idea what he's saying because you cannot downregulate genetic markers with oxygen. That's absolutely garbage.
As they would create this chronic state of inflammation that is really detrimental to our health. So we want to
genetic markers causing chronic inflammation in the brain. Citation, please.
Decrease inflammation, and we can do that really well with hyperbaric, which is really important. That's one of a major tenet of what we do with hyperbaric. And that's not all. And another thing that it does, which is very exciting, anywhere in the body and in the brain, but especially in the brain for me, because that's a lot of the work that I do, is that it it increases your stem cell release. So when you have an increase in stem cell production.
Real quick, there actually is data that supports that hyperbaric oxygen does increase release of stem cells. So there is potential for that to be correct. I'm not going to really debunk that point because there is data on that, but we'll see if he says anything really out of left field here.
Then you're able to stem cells are used not increase stem cell production, but increase in stem cell release. So it increases stem cell release in the brain, or neurological stem cells, and also in the body, that come out of our bones and those types of things. So the brain and the body that are really important for all healing. We really need stem cells for healing, and those are super important part of healing the brain and any tissue in the body.
So I would love for him to, again, specify what he means by healing. I would like mechanisms. I would like specific measurable objectives. So when we have any kind of therapy that's being used in any area of medicine, you need to demonstrate specific mechanisms. Like if I say that I have an antibiotic, I give you an antibiotic for obviously a bacterial infection. It doesn't just kill the bacteria. I mean, it does at its surface level, it does. But there's a way that it does that. It might inhibit ribosome activity. It might inhibit cell wall formation. It might inhibit folate synthesis. Those are specific measurable objectives that you are achieving with the antibiotic therapy. Just saying that an antibiotic heals your body would be vague and inappropriate. You do not base a treatment on something vague. You need measurable objectives. And he's not doing that here. He's just saying that it increases stem cell release and that causes healing. How? Tell me how it does that, how we are measuring this. Give me some kind of data that tells me that you understand what you're talking about.
To form better function in these tissues and organs. And we also, which may be understood here, I'm going to draw increased stem cells. Some of these things. One of the things that's extremely important for people with brain injury and after brain injury is that most individuals get some kind of autonomic nervous system effect. And so this autonomic nervous system is really important for, this is your sympathetics and your parasympathetic system. Actually, let's draw that just a little differently. Because your sympathetics, sympathetics are not bad, but we're going to draw them as if we don't like them here, okay? And your parasympathetics. So this one is like the relax and digestion one. This is the one, this is good blood flow to the brain.
Okay, so he knows about the autonomic nervous system. He knows at least
in our digestive organs. Sorry, my finger isn't the best use of writing utensil here. And the sympathetic is going to pump blood more to our skeletal muscles, which is really important, right? I always use the example, if a grizzly bear barges into your living room, you really want the sympathetic system to be working. That's your anxiety producing. This is anxiety. This is,
I think I know where he's going. I think he's going to say that it,
all those types of systems,
inhibits
worry, that type of thing.
the sympathetic nervous
these are the systems
system
that,
for
there's
people
worry
who
happens
have
when you this
anxiety.
chronically.
I
But
think
this is important, right? To have
I
the
think
bear
that's
comes
where
in, it
he's
actually
going
should
with
make you
this.
anxious. You should understand that it's dangerous, and you should pump blood, and you should do something and get out of there. The problem is when this system is on all the time, because it's not being regulated well. And who regulates it? This parasympathetic system regulates this. So this parasympathetic system generally inhibits this sympathetic system. And the parasympathetics are like, different. There's different parts of the brain that I won't get into, but that regulate more sympathetic and more parasympathetic function. And so when concussion occurs, usually with brain injury and those types of things, we usually get an effect to these areas that control parasympathetic. So we usually have a reduction in parasympathetic activity. So now we can inhibit the sympathetics, and they go buck wild. Okay, so when that happens, you become, you may be anxious, you may feel those types of mental, emotional types of activities. But a lot of patients that we see with this, they have, so we're going to draw this, we have a decrease in parasympathetic now because of the injuries, we have an increase in sympathetic. This doesn't happen only with head injury, but I'm using the head injury as an example because it's a very good one, a common one that we use.
So you can get some autonomic instability with concussions and things. He's not wrong there. The question is,
with this, actually, let's draw that in red so it's understandable. So a lot of people have brain fog. A lot of people get dizzy and lightheaded. That's different than spinning. Spinning is called vertigo. This is dizziness.
Okay, yeah. So this could
get fatigued much faster.
This could be
with their memory, not doing
something that would be legitimate.
Be slow processing.
You could totally use oxygen for brain fog, for fatigue.
It's not everybody, but you stand up and you get this lightheaded.
For being lightheaded, sure.
You just got a little out of it for a second. You stand up too fast. And most of us have experienced that at some point in our life where we just are laying down. It's, and we get up and we've been down for a while and just kind of get a little lightheaded. But these people get it a lot more, get it chronically. And so this is happening all the time. So their brain is really getting a reduction in oxygen. Now, with hyperbaric, we know that we can increase oxygen to the brain and help heal those areas of the brain. Now, the areas that control autonomic are in the brain.
Again, how do you heal them?
They rely on a lot of these sensory systems in the blood vessels around our heart, in our carotid arteries, aortic sinus, these types of things. So the blood vessels regulate a lot of this. And what hyperbaric does is not only does it heal the brain in these areas that are controlling this, which is extremely exciting for me because this is a lot of my patients and it helps tremendously, but it's also actually exercising and regulating and stimulating the appropriate autonomic activity at the vascular level.
So if you have autonomic instability, you can get a lot of detrimental effects from this. That can affect your blood pressure. It can affect your temperature. It can, of course, give you anxiety like he's talking about. It can make your heart rate uncontrollable. There are a lot of things that autonomic instability can do that's very detrimental. You should not be seeing a chiropractic neurologist for autonomic instability. You should not be going straight away to hyperbaric oxygen. You should be going to a neurologist, or even you might have some issues like that with endocrinology if you have an adrenal tumor or a pheochromocytoma. You can get similar symptoms. I think he's specifically talking about related to a concussion or post-concussive syndromes. You need a neurologist. You do not need a chiropractor who's just going to prescribe you this hyperbaric oxygen because, look, I was told that this works and I'm going to do it. No, you need a thorough evaluation by a doctor who can rule out other issues and who can give you appropriate therapies, because this is probably not the answer for everybody. And again, oxygen can be toxic. And if you're doing this over long periods of time, over many years, you can get toxicity. So even if, and I'm going to give him the benefit of the doubt here and say, sure, you do get some healing activity in the brain via stem cells from this hyperbaric oxygen therapy, but this should not be your first line unless you go to a reputable neurologist, board-certified physician who can appropriately diagnose you and treat you. This is not a person that I would be trusting with something like that, especially for autonomic instability that can cause a crisis, or it could be the result of a cancer or something like that.
Healing this autonomic nervous system and helping to regulate it at certainly the blood vessel level, and we could extrapolate that it would be healing it at the brain level too. because we do see this all the time.
You should not be extrapolating
when we're doing this type of therapy.
That you need data. I don't want extrapolation of what you assume
that's really
would happen. I want data of what we know will happen.
A big difference in people's lives, and it certainly makes a big difference too if you're anxious or stressed, or you have that emotional kind of dysregulation too, which comes along with some of these things.
So I'm kind of getting tired of this guy. We only have a few minutes left in the episodes. I think I might go back and address the rest of what he says later on, but I do want to show you all another chiropractic office and their website and what they advertise that they treat with hyperbaric oxygen. So let me pull that one up for you. Okay. So this is a chiropractic office, not a physician, a chiropractor. And I've seen plenty of chiropractors online advertising that they are physicians. They are not physicians. They are legally allowed to say that they are chiropractic physicians, but I think that's very vague and misleading to people. They are chiropractors. They are not physicians. But this website advertises the conditions that they treat with hyperbaric oxygen therapy. So acute and chronic anemia can be treated with hyperbaric oxygen, and it is approved by the FDA for that purpose. However, if you have acute anemia, you probably need a hematologist, especially if you don't know why you have an anemia, or even if you have a chronic anemia and you don't know why. You need a hematologist because there could be an underlying condition that's causing it. You could have a vitamin B12 deficiency. You could have an iron deficiency. You could have an internal bleed. You could have cancer. Going straight to a chiropractor for something like that, probably not a good move. Here we are. ADD and ADHD is on the list. Autism spectrum, they call it disease, which is concerning because it's not, we're finally recognizing that people who have autism are not diseased. It's a variation of normal. It's okay to have everyone have their brains work differently. It's not a disease, but they are referring to it as a disease, of course, because they're trying to tell people that if you have autism, that you need to be treated. And that's not true. It's not true at all. And that's dangerous for many ways. It's dangerous on a health level. It's dangerous on a societal level, on a stigmatizing people. And this is not okay. This is absolutely not okay for them to be marketing this and to be taking money from people to give them this bunk treatment for what is not a disease. Exactly. It's not a disease. I lost my page. Here we go. Depression. They're saying that you can use it for depression or anxiety. And okay, if being inside a tube of oxygen helps with your anxiety, I'm not going to tell you not to do it, but be careful. Have somebody that can monitor what you're doing and make sure you're not having symptoms of toxicity. And that's up to you and your physician. But don't go to a chiropractor for that. Diabetic wound healing. Yes, it can be used for that. Go to a physician. Don't go to a chiropractor. Failed back surgery. Yeah, okay, sure. But again, go to a physician. Don't go to a chiropractor. I'm going to keep saying this the whole way down the line. Like, if you have any of these issues, you probably shouldn't go to a chiropractor. You need a physician. You need someone who can appropriately treat it. If you have lupus, by God, please don't go to a chiropractor for your lupus. Don't. Yeah, they're saying it can treat sports injuries like sprains and strains. Sure, you might get some healing, but I would need evidence of that. It's not approved for that. Also, it's really probably just a waste of your time because most of your sports injuries can heal on their own. or with other like physical therapy, more conservative measures, probably a waste of time and money. Do not use hyperbaric oxygen for your diabetes. Don't use it for ulcerative colitis. So, I mean, there are way more conditions on this list than are approved by the FDA for this treatment. And of course, there are some reasons why you might use something that's not FDA approved, or you can use treatments off-label, so to speak. But go to a physician that can appropriately treat whatever's going on. Chiropractors are not trained physicians. They cannot use these appropriately. If you had another underlying condition, or if you are at increased risk for oxygen toxicity, if you have COPD, probably don't use this. Oxygen is a drug. It needs to be used wisely and with regulation. And don't just trust everyone that tries to tell you that more is better. With that being said, I think that's all I wanted to cover for today. I'll shell out a little bit really quick. I'm going to put my link tree in the chat. I have a Discord. If anybody wants to join the Discord, please do. We have a fun community over there where we share memes. We talk about science-y things. It's a great time. I also have some merch. If you like my One of the Brotherhood or One of the Sisterhood, my trans merch, you can get some of that. All of that's in the link tree as well. I also now have a Patreon. So this was something suggested to me. It would help me grow my channel. I don't expect financial support by any means. Anything you want to throw my way is appreciated, but do not feel pressured in any way. It's just, if you would like to support the channel, that's a way that you can do it. Join the Discord, go back, like this video, like my other videos. Next week on Medical Myths, I'm not sure who the guest is going to be. Actually, no, next week. We won't be having Medical Myths next week because I'm going on vacation, so I might be taking a couple weeks off. So I'll probably come back in January for our next episode. But thank you all for sticking around. I hope this was good content. I know it was a little bit dry at points, but I hope you took something from it today. And I will see you all next time.